Hey everybody, this is Craig from the University of Applied Research and Development with our Emergency Response and Risk Management podcast and videocast. I'm delighted to have Francesca with us. She is a Senior Cash Advisor with Save the Children. Welcome.
Thank you, Craig, and thanks everyone for having me here and for spending some time and listening to my experience. I hope I can meet your expectations.
I'm sure you will. Why don't you tell us what your job is with Save the Children? Explain what you do.
Sure. So I joined Save the Children 4 years and a half ago as a humanitarian cash advisor, and in my role, in which I've been growing in the past 4 years and a half, I mainly do technical leadership around how to use cash markets as modalities of intervention in humanitarian context. So when I say I do leadership and I do policy making around that, I'm referring to defining how we should be working, what are the quality standards that we should be looking at and practicing in our projects in humanitarian context. I also develop trainings and tools and guidance materials for our colleagues in the country offices so that they can learn about this area of work and they can practice it in a confident way. So at the moment, I'm also leading a team of other advisors like me, and I'm also co-chairing a group across the movement, because Save the Children is a very complex organization. I can tell you a little bit about that. I chair this group across the movement with other cash advisors like me and other people, other colleagues that with their work, with their area of expertise, contribute to designing and implementing cash programs in humanitarian context and also in non-humanitarian context. The work these days is particularly hectic because of the COVID response, and because COVID has drawn a lot of attention on the importance of cash assistance to the populations that are affected by COVID. So I don't know if you want me to tell a bit about what cash assistance is and why we use that in humanitarian context.
I was going to ask, what actually is this? So please tell us.
Yes. So I don't know how familiar you are with humanitarian responses, but traditionally they have they were based on in-kind support, giving things to people. So providing them with food, providing them with tents, shelters, so providing them with water through water packing, mattresses to sleep, providing people with things. Besides, of course, ensuring they're protected from external threats, and also they receive legal support. So in the past 10, 15 years, I should say 15 years, yes, there has been a shift in that we have started, as humanitarians, we have started practicing or replacing in-kind support with cash assistance. By giving cash to people, by giving them vouchers like the food stamps in the States, we essentially give them the power to decide what they buy, what they need, and they will buy it, instead of us giving them things that perhaps are not necessarily at that point in time, perhaps are not reflective of their family composition and their priorities in that specific moment. And it would be very cost ineffective for us to try and understand and assess every individual situation in all of the households that are affected by a crisis, to understand exactly what kind of in-kind of package they need. So giving cash is flexible, is dignifying. It also, helps the economic recovery of local markets. So it's a plus in many ways. And during the past 15 years, the sector has learned a lot about it. Right now it's pretty much a consolidated practice, and there is a very clear intention by the global leaders that we should see more cash interventions than in kind in the future.
Wow. So you mentioned that giving cash dignifies people. Is that to do with the psychology of receiving the cash versus receiving a jacket or a bed or food?
Yes, it dignifies them because it gives them choice and power.
Right.
And humanitarian assistance in a traditional way can be quite disempowering.
Mm.
It's also stigmatizing to queue for in kind of, for these bulky food packages, it puts people in a position of being passive recipient of something that they may not even need.
So in your role, do you make a decision about when it would be best to use a cash strategy versus food and clothing and things? And how do you do that? How do you make that decision?
So in my role, I don't take decisions. In my role, I advise others to make the best decisions possible, also because the contexts are very, very different. So in my role, I produce those decision-making tools that will help my colleagues on the ground to make the right decision.
So tell us more. What might be in some of that checklist or that criteria or that analysis that you do?
Yes, so we would check, first of all, that cash is appropriate to the needs of people. Is it what they need? Is it, so the key question is, what are the reasons why people right now are not able to meet their needs? Is it because they don't have enough money? Is it because they cannot go to the market? Is it because it's not safe for them to go to the market and buy things? Is it because there are no vendors available selling the commodities they need? Or is it because there are no service providers providing them with essential services like healthcare and education or utilities for the running of their house? So we see if financial barriers and the fact that people don't have enough purchasing power, essentially are income poor, if this is one of the main reasons why they cannot meet their need. Only in those cases, only when a financial barrier is the main reason, then we would recommend the cash as the right solution. Because imagine if the reason is that there aren't the markets and the vendors aren't accessible, we give them cash, that cash would be basically useless because
Right.
they will still don't have anything to buy. So this is the first thing we check, the appropriateness to the needs. And there may be a web of causes that contribute to people not meeting their needs. So we should also pick other reasons, and cash should never be a standalone type of intervention. We would also look at pairing it with other types of interventions like awareness raising on the best feeding and nutrition practices for children, for example, to nudge people to make certain decisions. Sometimes what they lack is the information, the knowledge to make certain spending decisions and consumption decisions. So this is for the appropriateness. And then there is the operational feasibility. So for cash to be operationally feasible, we need the markets to be functioning, so the supply chains to be operating. And in the COVID context, we were concerned that import exports, supply chains would be disrupted, that the closure or the restriction of movements of people would impact on the physical access to the markets. And many other things relating to markets. So we were concerned that cash would not be the right solution, the most appropriate solution, and we always recommended our country offices to be ready to switch to in-kind when people cannot move from their house, for example, to go to the market, and they need to receive food delivered at their door, for instance. Then on the operational feasibility, we would look at the acceptance by the government that cash is a good solution for them. And there is a lot of controversy on cash and suspicion as well from the government that is the right thing to do. It may create dependency. That's one of the fears. It may go and fund a terrorist. There are many fears, and we first have to check that the governments of the countries where we're working in are happy with us moving on. And the same goes for the communities that we support. Are they, what do they prefer? Do they prefer cash or in kind? What's better for them and why? And then we would check that there are the financial services to deliver the cash or the voucher in a safe way, in a cost-efficient way. And I'm talking about mobile money, for example, services like mobile money, or the banking sector. Does it work? Is there liquidity? We would have to make sure that the financial services are available to deliver cash in a safe and efficient way. And the final point that we would consider is whether our organization is capable of doing so, or if we'd have to rely on partners for the delivery part.
Yeah, that's a lot of things to think about when implementing a strategy like that. Because I imagine in my country where I am in Indonesia, there was great concern with COVID, and this time of year, having families from Jakarta, the largest city, always traditionally going out to the regions. They would take the money that they've earned over the last year back to the villages. So there's a financial expectation, but if people can't travel because of the virus and fears of infection, that money doesn't transfer, and then there's whole villages that are waiting on that money to arrive are going to be impacted. So that, I can understand the need. I'd never thought about it like that until I was in this country. So tell us about some of the projects that you've worked on. I see that you're involved in Lebanon, and you've studied in Beirut and Geneva and Italy. You're very international. So tell us about some of the experiences that have brought you to this point.
Yes. Well, I can tell you how it all started. I graduated in economics in 2003, and immediately after, I enrolled into this program on development and cooperation, where I learned how to do project management in the development work. After that, my dream was to work with the WHO, the World Health Organization, as an economist to study the access to antiretrovirals, for the treatment of AIDS. And it was an interesting, economic problem for certain countries in the world not to be able to access these drugs because of patents issues and cost that were driven by the patents. But the WHO never looked at my CV. So they completely ignore me. I never received a response from the WHO. And perhaps that was the right thing, because instead I was proposed to do an internship in the International Labour Organization in the crisis response team. For those who know, the International Labour Organization is not exactly a crisis response organization. It's more of an organization that sets the policies and regulations, and that convenes different parties around themes like labor law and employment and rights. And this team instead was really action oriented. It was a small team that responded to natural disasters and conflicts by orchestrating and bringing in the expertise from the many departments of the ILO to give the best response. So I spent 6 years with them, and I learned I learned an awful lot, because all that I know now, I think it was because I was with them for 6 years. And I also had the opportunity to travel. So very gently, I was sent to different emergencies to provide support to our country offices over there. I went to Indonesia after the tsunami, for example, or in Sri Lanka, again after the tsunami. I went to Argentina because initially we were also responding to economic crisis. I went to the Democratic Republic of Congo for a needs assessment, to Bolivia after the floods to do a needs assessment as well, and to Gaza after one of I never know how to talk about Gaza and using politically correct terms, but yes, in February 2009, I went to Gaza to support, I think, a design of a program and identification of a partner. So I had the opportunity from the headquarters to get my hand dirty, but and to come back and to have the time to reflect. It was a very privileged position to work at the head office level, but at the same time get a hands-on experience in the countries without committing to spend my entire life in the field. And then I decided that it was time to go to the field, and I went to Pakistan after the floods in 2010. I left the ILO and I went with the International Rescue Committee, which is an American NGO. And over there, I led my first program, which was a cash-based program using many different modalities because I was very inexperienced, and so I wanted to do everything, and learning a lot though. And then went back with the ILO in Iraq for an economic recovery, economic development program, a completely different field from the NGO world, and then back again with IRC in Lebanon. And it's in Lebanon where I think that I consolidated my cash experience. Lebanon has been, I think, a fantastic place for many of us working in the cash sector, because it was a relatively easy context where to experiment and where to try things and make them work and learn from them. So we set up a very big cash program that was targeting the refugees, the Syrian refugees in the country. And because of the context, we could be very sophisticated in our approaches, and there was a massive emphasis in learning and impact evaluations and in designing very complex targeting methodologies. It's not a typical humanitarian context, I have to say. And yet the learning from Lebanon has sort of shaped the future of cash. Also in a dangerous way, because it created expectations that we could do similar things in other countries where the context doesn't allow to do that. And so I stopped there for another master in epidemiology, but I will stop here.
In Beirut?
In Beirut, yes.
Right. When you say that you're able to experiment and do many things, was that because of the unregulated nature of the environment you were in? No, I don't think that was the reason. I think that the level of capacities was very high in that context, with a very high concentration of national and international staff that could, come up with innovative ideas and push the boundaries, and also because of the financial services and the financial institutions that we could work with.
We didn't have to bother with how to do cash transfers because the financial services are widely accessible. So we could think of quality rather than the operation of the transfers, and we could reach a very, very high scale, wide scale of outreach.
I'm glad I asked the question.
Hmm?
I'm glad I asked the question. That's really good to know about what enabled you, the environment you're working in, to provide those and test those models. Because this is something that not many people probably in emergency response and risk management have ever thought about in terms of a way you can respond to a situation. If someone wanted to move into this area as a career path, what are some things that you think that they need to build into their planning and preparation and experiences between now and when they try to get into that?
There's no one way to enter the sector, and mine was quite unorthodox because I started in a head office. You normally would start in a country, in a response, and experience firsthand what it means to do emergency or humanitarian responses. And humanitarian responses are all different from one another. You have the protracted crises, which are the most typical kind of context that in which we work now, and the most common type of crisis in the world right now are protracted emergencies. And then there are the sudden onset crises, the earthquakes, the floods, the hurricanes, and the set of skills and attitudes are a bit different. So in a protracted crisis, you can come in with a development mindset. You can have an ambition to innovate, to try, to experiment, to improve over time. In a sudden onset, perhaps you have to start with a good enough, with a quick and dirty solution, because what is crucial is that you deliver assistance immediately, because that's life-saving. So you have potentially two different types of people engaging, but in general, the nature and the soul of a humanitarian person, which is something that you don't learn anywhere, it's something that you either have or you don't have, is that of helping others, right? So if you, and instead of being very generous with your time, because the working hours in a humanitarian response are insane, and the pace is hectic, and the situation is complex, and perhaps sometimes you also don't have access to the essentials of living, or comfortable living as well. You need to be prepared to live in a context where your movement is restricted, where you can't go out, where you have to stay in. And in Baghdad, for example, the offices don't have windows, because windows are potentially dangerous. If rockets explodes, and the shrapnel and the glass from the window can be very harmful. So
wow.
you work and live in spaces with no windows. So I think that first of all, there has to be an attitude. There has to be willingness to endure that, because it's rewarding at the same time, but it takes you away from family and from comforts.
So I was just writing down that this attitude of having the desire to help others, to get you through the loss of freedom, the loss of personal time, the loss of comfort is one, and the endurance to recognize that you might have restricted freedom and you don't have the comforts of home, and you don't know how long that might last. So the attitude of helping people and the attitude of endurance, would you say those are important?
Yes, very, very, very important.
Okay.
And being a hard-working person.
Right.
And also being a fighter, I think.
A fighter?
Because you have to, a fighter. Yeah. Yes.
Tell us
I mean,
more.
these are the qualities that I have, but probably there are many ways of being a humanitarian. But all of the colleagues I know, they are like that.
Right.
So these are common traits. You need to be ready to raise your voice and to go against um, to go against the mainstream sometimes, and to be in the uncomfortable position of standing your ground when the politics of it may put your own work in danger, and you're there to raise the voice of others that at that point don't have a voice.
Mm.
You're there to make things right. And there is a lot of politics in the sector. So you need to be ready that, the politics and the wars, those political wars, I would call them, may also be quite draining.
Right. What are the things that you do to get yourself through and to keep going forward?
I have no idea. I have no idea. I keep going. I have a goal, and I don't know if what keeps me going is that I'm an optimist deep inside, and I believe that we can make changes, but the changes are not going to happen overnight. So I do remind myself of the achievements, especially in times when it's hard and when I may not see a solution, I may not see the light at the end of the tunnel. So, and I try to do yoga and meditation. So, especially now in COVID, it's been absolutely crazy since March. I keep a timesheet. My average number of working hours in a month has been around 200, and I think I already reached now in June the 160, 170 hours of work in 19 days into the month. So it's very, very long working hours. And the risk of burnout is always there for humanitarians. And in the field is especially visible because of the difficult living conditions and the fact that you don't have an escape, or you can't just go out and have a walk. And I'm lucky enough to find myself during this COVID response in my own flat, and in a country where I can walk out, I can have chats with family and friends over Zoom or Skype. But in the field, you see a lot of alcohol abuse. It is something that in the most difficult context you may witness. And these are coping mechanisms, right? So your question is very pertinent. You need to have a healthy coping mechanism to respond to the times of stress, because there is a lot of stress in this field of work.
So would it be wise for people that want to work in this area to consider and practice and develop those self-management, those meditation, the yoga, the ability to decompress themselves each day, so they have that before they go into the situation, and also recognize that when you are able to leave the situation, the project, the response, the project, that you take adequate time to decompress before you go into the next one?
For sure, for sure. And there's yoga, there's meditation, but there's also cooking. I mean, everyone has different coping mechanisms. The
Right.
important thing is to find a healthy coping mechanism
Right.
that doesn't, drain you off or damage your mental well-being or your physical well-being. Yeah. But these are things that you learn, right? When I was younger, I wouldn't think about that. I would also have a different level of energies. Things that you learn, you just need to go for it and try.
Francesca, I really want to thank you for your time and for your effort and sharing your experiences. And it's a new topic for us, for our curriculum, and I'm glad that we've been able to speak with you about this and hear about your experiences and understand about cash as a response. And also this very pertinent thing that you're talking about decompressing, having time for yourself, developing those coping mechanisms, understanding that those difficult environments may be much longer than you expect that they're going to be. These are important things to know. So thank you very much for sharing your experiences with us.
You're welcome. Thank you very much for having me.